I'm going to go over the Follistim injection pen. Prior to giving your injection and preparing your medication, you do want to wash your hands thoroughly and dry them, and you want to use a clean, dry surface to prepare your medication. Follistim is follicle stimulating hormone, which your doctor has prescribed to help stimulate the follicles to grow on your ovaries. For your Follistim, you are going to need the Follistim pen, the cartridge of Follistim that you'll store in your refrigerator, and the pen needle along with alcohol swabs and the biohazard box. To prepare the pen, you're just going to pull the cap off. You will unscrew the yellow part from the base of the pen. You will grab your cartridge. You do need to clean the end of the cartridge with an alcohol swab. You will take the cartridge metal side down and put it into the yellow part of your pen. You then take the base of the pen, the ratchet will fit inside of the cartridge, and you just screw it on tightly. It is important on the Follistim pen that you line up the arrow with the dash on the pen. Once you have your cartridge loaded into your pen, you're going to dial your dose. You will just turn the base of the pen towards you to get your dose dialed into the window. Your nurse will go over the prescribed amount that your doctor wants you to take. For demonstration purposes, we're going to dial in 75 units. If you pass your dose on the pen, you have to go all the way out until the base of the pen gets real loose. Push it in until it clicks, and then dial it again to get your dose dialed into the window correctly. Once you have your dose dialed in, you are going to clean off the end of the pen with the alcohol. Let the alcohol dry, and then you're going to take your needle, carefully peeling back the paper, and that's going to screw on the end of your pen. Screw it on tightly, and then you'll pull the big cap off of the pen. To prepare your site for injection, you're going to take an alcohol swab. Your abdomen is the site. You want to stay at least an inch away from your belly button, but anywhere in the outer part of your belly, you will just take an alcohol swab, wipe the area, let the area dry before you inject. You will remove the small sheath that's over your needle, and because you have your dose dialed in, your needle is automatically primed and you're ready to give the injection. You're going to pinch the tissue, push the needle all the way in to the hub, and then you're going to push on the base of the pen to inject your medication. The base will twirl as it goes in, and once the medication has all been injected, the window will read 0. Once the medication has been injected, you will count slowly to 5. 1, 2, 3, 4, 5, and then pull straight out. To remove your needle from the pen, you're going to carefully slide it in to the cap, unscrew it, and then discard it in your biohazard box. You will then recap your pen, and you can store it at room temperature until your next injection.